Good afternoon, and welcome to now the 37th show of the COVID Coalition for Communities and Families. So here we are, now almost 9 months into this pandemic. And we all know that we are in a remarkable place in time because now, even though we had the challenges of a pretty horrific spring, we tapped down, Michigan masked up, Detroit masked up, did the safety protocols, and we lowered our rates. But now we find everyone that we're back needing a pause. And like we do every time we come to you families, we are going to bring you information, trusted resources, and support to help us to continue to keep ourselves and our families and our community and state and nation safe. So we're hitting pause. But by the same token, we're not hitting pause on some things. For example, the vigilance that we need to have to protect our vote, the vigilance we need to have to protect our families. And as you all know, that through our weekly town halls, we constantly bring you information and knowledge because knowledge is power. And I'm feeling a little bit powerful today because I have with us today not only our wonderful moderators and all of us that bring you the program today, but we also have the voices of people who are in the know, both from the state of Michigan, locally, and also from voter protection. And I guess I should share with you my name. My name is Jametta Lilly, and I'm a proud member of this coalition. I'm blessed to serve as the CEO of the Detroit Parent Network. I'm a Detroiter, I'm a Nana, but most importantly, I am a citizen and I know my power and I welcome you to listen in so we can execute our power to stay safe and make sure that our voices are being heard. And speaking of voices, we need to hear your voice. So please make sure that if you're on Facebook, that you can chat us. You can also text us at 313-288-2082. And now we're going to move forward with a really exciting and substantive program that we have. And with me always in this wonderful process of sharing information and empowering our communities is none other than our co-moderator, Christine Bell. Christine, please come on board. We're delighted to see you. And let's make sure that we're loving and sharing information to keep us safe. Go ahead.
Hey, Jametta, thank you. It's wonderful to be here. I missed everyone last week. Again, I'm Christine Bell. I'm the mother of three really amazing children, one of which is having their first birthday today. So everybody wish Quentin a very, very happy 5th birthday. I'm honored to serve as the executive director of UNI and a proud member of this coalition. And so just to remind everybody, we are translating the town hall to Spanish and ASL, and we want to give time for folks to get onto the right line and get comfortable because we have some really awesome experts here today that I am truly excited to hear from. So Christina, could you please share the phone number for Spanish translation?
Yes, definitely. Good morning, Christine.
Good morning, Christina.
Great. If you need Spanish translation, please call 313-626-7440. Si necesitas traducción en español, habla al 313-626-7440. Hoy la señora Gloria Rosas y tu servidora Cristina Ruiz Mazón haremos la traducción. Gracias. Thank you, Christine.
Thank you, Christina. What a great name. And so, Julie, could you please share the instructions for ASL? Thank you so much, Julie. It's great to see you today. So as Jametta said, we really want to hear from you. We want to hear your questions and your comments. You can put those in the Facebook chat or you can text them to 313-288-2082. Again, that phone number is 313-288-2082. 2082. And again, this is an opportunity for you to ask experts your questions directly. So, or share your comments with experts directly. So please make sure you're chatting with us or texting with us. Please stay with us for the next 60 minutes so that, as Jametta said, you can stay informed and powerful. We all need a little bit of that right now. We are here to talk with experts, and we just gave you the text line. We will have time after each segment for question and answers, but keep your questions and comments coming because we're collecting them as our experts are talking. And please remember, if we can't answer a question today, we're committed to getting the answers to you by early next week. And all questions asked today will be posted with their answers on onedetroitpbs.org. Just a couple of reminders for our experts. Please remember to speak slowly for our translators. They want to make sure that they're translating the important information that you're sharing correctly. Also, please turn off your cameras if you're not speaking. This is to ensure that our ASL interpreter can be seen. And also remember to mute yourself when you are not speaking. Terry Whitfield is our timekeeper, so keep an eye on your chat. Terry will chat you your remaining time, and if you go over your time, Jametta or myself will come onto the screen and gently remind you to wrap it up. This is all important so that we can make sure that we get to ask you questions from our audience. And it is my pleasure today to welcome Cindy Gamboa, who will be kicking us off today. Cindy? All right, so Cindy is not with us quite yet, so I'm gonna kick it over to Jametta, and she's gonna get us started with our guests. So Jametta?
Yes, thank you. And it also gives me an opportunity to pause just for a moment. For those that are listening, we want to make sure that you're setting tight. We all know that our very phenomenal governor has issued a pause for us. And we're going to have the opportunity to hear from the Michigan Department of Health and Human Services to give us direct information about, well, what is it that we can do and what is it that we should not be doing? And by the same token, while we're going to hear from our public health officials, which is always critical, we're also going to hear from our physicians. And in particular, we're delighted to be able to welcome Dr. Zervos, who is the medical director of infectious diseases at Henry Ford. In addition to those voices, particularly as we think about the impact of COVID on particular populations in our community. We know African Americans and Hispanics and others, particularly those who suffer additional health conditions, are most at risk. And diabetes is one of those areas. So we are very delighted to be able to have in the program a physician from University of Michigan to join us in this conversation. And also what we would like for you to do is make sure that you're staying tight. This is the week before Thanksgiving. And like we always do, we're going to be doing some truth telling about what really is the history of Thanksgiving. So I think hopefully you have a really good feel for how dynamic our program is going to be today. So what I'd like to do is to go ahead and to begin this conversation and ask Dr. Marcus Zervos if you could come on screen. You are so welcome, and we would love to hear from you. What are the things that we need to understand at this really critical juncture, and particularly as we think about the upcoming vaccine? Welcome, Dr. Zervos.
Thank you very much. Appreciate the opportunity to be here. I do have a few slides that I'll go through, not all the details of, but relatively quickly. Go to the next slide, please. We've heard a lot about vaccines lately, and the traditional development of vaccine, as shown in this slide, can be anywhere up to 10 years or longer. And for some vaccines, we've never been able to produce a vaccine. HIV is an example of that. Next slide. The COVID vaccines, however, have been under an accelerated approval, and there are 3 different what we call platforms. The one platform is the messenger RNA. It's a unique development of vaccine, and there are 2 vaccines that have been developed under this platform, Pfizer and Moderna. Both of these have gone through phase 3 studies, and the data on both of these look really good. For the Pfizer vaccine, after 42,000 subjects were included, they're up to a 95% efficacy. And Moderna, we were part of the Moderna trial at Henry Ford, and the phase 3 enrollment on that is completed, and that also has a 95% efficacy with no major safety issues in either one of them. There are 2 attenuated virus vector vaccines. These are weakened viruses that have the part of the COVID protein on them, and these include a Johnson & Johnson vaccine, and Henry Ford is now in a study of that, and the other one is AstraZeneca together with Oxford, and the phase 3 trials, meaning the trials in humans, are now underway in those, and those are again both very large studies. Next slide. And this slide shows some of the details of some of the vaccines that are being developed. Next slide. In looking for a vaccine, the goal of the vaccine is to prevent, and it's our most important measure for preventing the further spread of COVID. And in looking at vaccine development and vaccine deployment and study of vaccines, it's important to recognize the health disparities, and health disparities are very significant for COVID. Compared to white people, African American, Hispanic, Native Americans are 3 times more likely to contract the virus, 2 times as likely to die, and this is compounded by a variety of different factors. Next slide. And these factors have been determined social, racial determinants of health, and they include a combination of economic, working conditions, and access to medical care. Next slide. Maybe hit it again. Yeah, keep going. So in the determinant of health, there are a lot of factors that go into it. It includes age, gender, underlying disease, but also working conditions, and whether there's pollution, food insecurity, all have an impact on health, and also on acquisition and response to COVID infection. Next slide. In determining health, there are a combination of also cultural factors and access to care, and also beliefs about health, meaning how do people feel about the same issues. Next slide. Next slide again. So there are a lot of challenges in, go back one. There are a lot of challenges in the vaccine distribution. We anticipate that we're going to have a vaccine initially as early as late December. The next step after the phase 3 trials will be that there'll be an emergency use approval, hopefully by end of December. There are issues around mass production of the vaccine. We want to learn from earlier mistakes like we had with flu vaccine distribution campaigns. We need to overcome poor access to healthcare. We also need to overcome racial and social disparity in the vaccine distribution, and we need to overcome vaccine hesitancy and lack of trust in getting the vaccine. Next slide. The plan for deployment of the vaccine, so we will get likely initial doses of vaccine in end of December, hopefully, but we won't be able to vaccinate everybody or everybody who wants to get vaccinated probably until spring. But initially it'll be hospitals, most vulnerable population, like people living in nursing homes, critical infrastructure, food, transportation, teachers, energy, people at high risk of severe COVID because of underlying diseases like diabetes and obesity. And then people over 65 years of age will be prioritized, and then everyone else after that. Next slide. The way that the approval will be done and deciding on one group or another will be based on CDC recommendations, and this will include working with partners at the health department and the hospitals and clinics to be able to deploy vaccine. Next slide. The goals include with the vaccine is to reduce death, reduce serious disease, reduce the burden of infection. We keep in mind ethical principles of maximizing benefits, minimizing harm, making sure that there's justice, transparency, and that we eliminate health inequalities in the distribution of the vaccine. Next slide. It is very important to have diversity in the vaccine deployment and also in the trials. We were we put a lot of attention in the studies that we were doing to make sure that we had minority populations in the vaccine studies. We know that certain diseases and medications impact people differently. There are differences among racial and ethnic groups. We have an ethical obligation to make sure that the vaccines are not only effective, but they're safe in all of the population that we study and that we deploy the vaccine. Next slide. We need to be aware of, besides social racial disparities, we need to increase awareness, opportunity, and especially trust. We need to improve trust of the hospital systems, of public health in the deployment of the vaccines and build trust. Next slide. The way that we're going to do this is once the vaccines become available is to emphasize the importance of the vaccine, that safety is our priority, to address concerns, to do outreach campaigns using trusted partners. So, I guess it's good to hear from me as the head of infectious disease for a large health system, but more important is for people to hear from trusted partners within the trusted people in the community. We've done flu vaccine campaigns before, for example, using pastors in large churches or congregations in the city. That's been much more effective than me saying that a flu vaccine is needed. And we're going to build on developing awareness materials that'll include a variety of different campaigns to get this information out. Again, and what I'll finish with is to say that the vaccine, although important as it is, doesn't take the place of other prevention measures, the distancing and masks, and the other things that I think others are going to talk about during this session. Thank you again for your time, and it's a pleasure for me to be able to speak to you today.
Dr. Zervos, it's a pleasure to have you. You laid out a lot of heavy information for people, not only in terms of how the vaccine is created. You also talked a great deal about the other social and economic determinants of health and the hesitancy that we know that many people have based upon a lived history of disparities and racism that has existed in the healthcare and medical field. We may have some questions for you. So I'd like to ask Christine, have we had any questions to come in yet?
We do. So who will decide who gets the vaccine first?
So, no, that's a really important question. So once the vaccine is available, it'll be in relatively limited supply, and we won't have large numbers of supply probably till spring of next year. There'll be at least 3 or 4 different vaccines that'll be available, and there'll be recommendations for who gets it first that are going to come from the Centers for Disease Control. It's called the American College of Immunization Practices, ACIP, and they're the ones that make vaccine recommendations all the time. for any vaccine that we have. But the deployment is actually going to happen at a state level, city level, hospital level, and that'll be a partnership between the health departments and the providers in the clinic. So the decision is going to be a partnership between the CDC and through the local health departments and the hospitals. But more than I've ever seen in my entire career, the basis for the decisions is this is the first time ever that the decision is not just logistic of how to get vaccine out, but we're taking into account looking into vulnerable populations, looking at issues of disparity and health disparity, social disparity, and deciding on who should get vaccine first. I've never seen this happen ever in a vaccine distribution campaign until now.
That is so good to hear. And in terms of, I think some folks that are concerned about vaccines are concerned about what is in a vaccine. What, in addition to the, well, I don't know enough about vaccines to say, but I know sometimes there's the active disease in the vaccine but I think it's the other things that are in the vaccine that are concerns to people. Could you just speak a little bit to what the composition of a vaccine, like what's the recipe? What's in the sauce?
Yeah, no, that's an important question. So safety is a priority for us in this, and even though there's been an accelerated approval or development of the vaccines, all of the safety issues as far as doing these studies have been done. The studies have been very carefully done. They involve large numbers of subjects. They are done more rapidly, but the more rapid part is because there's been a lot of investment by the NIH and government and industry to be able to get through these studies quicker than what we would usually do. So that the safety is determined through these large studies, and so far there haven't been any safety related issues. But what is in the vaccine is actually, none of these are live vaccines. There's some vaccines that are live, what we call live vaccine, where you take the germ and you give a weakened form of the germ to the person. But none of these COVID vaccines are like these. These are all parts of the virus. They're all just like there's a spike protein, a little piece of the virus that's used in all of these vaccines. So none of these involve a live virus or an active virus or a weakened form of the COVID virus itself. But I think in evaluating a vaccine safety, the trials are important, but it's also important to look at, well, what's the risk or benefit or one thing of another. So there's always a small chance of having a reaction to a vaccine. Most people get soreness of the arm, is the worst thing they can get, or maybe some flu-like symptoms. But on the other hand, if somebody gets COVID, they can end up in the hospital or even die from it, especially if they're elderly. So the way we look at it is evaluating what are the risks or benefits of doing one thing or another. But in terms of the safety, so far it doesn't look like there's any safety issues. It looks like it's a vaccine that is going to be similar in side effects to other vaccines that we commonly use, like flu vaccine. I know there's distrust in that vaccine also by some people, but I think it's still important to keep in mind that the disease is worse than a theoretical concern from getting a reaction to the vaccine.
So a few more questions. Should I be tested for COVID before getting the flu shot?
So we are encouraging the flu shot, again, because flu is very serious, and getting flu and COVID would be a particularly bad combination. So it's not too late to get a flu shot. Actually, we haven't seen much flu in Michigan now, and maybe that's because people are wearing masks. Usually by now we see a lot of flu, but we haven't seen much flu, and maybe the masks are helping with that. But the flu shot is still recommended, still should be given. It's in terms of when the COVID vaccine comes out, we'll get a question about, well, should I be tested for COVID before getting the COVID vaccine? And we're saying no, just go ahead and get the vaccine, because we don't know how long that antibody protection will last from having COVID and And so we're suggesting if somebody is a candidate and they can get vaccine, they should just get it at the, it'll help to boost their immunity and how long the protection is that they'll get from it.
Great, thank you. When do you think schools and children will be able to receive the vaccine? Since the vaccine will likely be 2 shots, how do we make sure people get both?
Yeah, so the Pfizer and Moderna are 2 shots. The Johnson Johnson is 1 shot, and hopefully that'll get approved sometime maybe early next year. But the 2 shots is going to be logistically is a lot more difficult to do, but is going to be needed for the first 2 vaccines that come out. Children are going to be the last ones to get immunized. So teachers, people working in schools, will get immunized first. They'll be within the first groups, but the children will be the last to get it for 2 reasons. One, I mean, children get COVID and they can get sick from COVID, but they don't get as sick as adults, especially elderly or people living in nursing homes. But also we like to have more information on the safety, including studies in children, before we say, okay, give it to children. So they'll be the last ones to get it. So it probably won't be till spring, summer of next year.
And when you say next year, you mean 2021, correct?
Yes, I mean 2021.
Okay.
Yeah, the first vaccine will likely come out by the end of this year, by end of December, and then it'll start to get deployed out the beginning of 2021. And we're hoping to get many people immunized by the spring of 2021.
Great.
Summer.
Who is reaching out to build partnerships in the community to build trust? What groups will you be enlisting to help? And I'm certain this person might be volunteering too, but so who are you working with in terms of building trust with community, and what groups are you enlisting to help outside of the churches that you talked about?
So that is an extremely important question, and I think it's the most important question of the day, because we do need to reach out to the community. We need to build trust in the community, and maybe somebody from the health department wants to comment also. But the working with the health departments, both the state and the city, I'm very involved with the city of Detroit health department, and I don't know if Denise Fair is on the phone, but there's a lot that the city of Detroit is doing in the health department, working in the community. Henry Ford and others are working with various community groups. So it's not just the churches, but other community groups to build trust in the community and to work with trusted partners in the community, like this group that I'm talking to now, to build up trust on the vaccine, answer questions, address barriers along the way. So it has to be a very broad reach to the community, and Henry Ford works with a lot of different groups. But I think to make this successful, it has to be a partnership between, and we've seen this many times, and we've seen examples of failures where we didn't get ourselves together. We didn't get the universities together, the hospitals together, the health departments together, local government together, and of course, community groups and the residents to say what's important to them or not and what is needed. Without that kind of partnership, it's not going to work well. And that is being worked towards being done, and more work is needed in that. And I really appreciate that question. That's the most important things we could be doing from now.
Well, I'm going to go out on a limb and say that this coalition would be very happy to help in whatever way we can as a coalition, and then also as individual community partners. Jametta, I have one more question. I think it's really important because I know for a lot of families, testing what has been complicated and people were charging and so this question is, will the vaccine will this vaccine that's going to be available for people without insurance or Medicaid? Are those at risk going to be prioritized first?
Yes, it's my understanding that the vaccine is going to be available free to anybody who wants it. I've heard people talk about mandatory immunization, but that's not going to happen. But it is going to be available free to anybody who wants it. And yes, people will be prioritized. So healthcare workers, first responders, critical infrastructure, people living in nursing homes, underlying disease are going to be the ones prioritized first. So, within the city, there'll be Detroit, and I'm a Detroit resident also, but I think as Jametta mentioned earlier, but there'll be groups that go out but there'll be groups that go out to the city and we're even looking at doing mobile deployment, but there'll definitely be a prioritization to people who need the vaccine most.
And so I just want to give you a final word and something that's more immediate, and that is Thanksgiving and the new epidemic order, and seeing that you are a fine infectious disease doctor. Mm-hmm. What is your recommendation to all of us around Thanksgiving?
So I see somebody from the state is on the call too, so they're going to talk about that, but I am in full support of more restriction, because we need more testing. We need more availability of testing. We need to, continue with contact tracing and, and all that. But we also need to keep up the social distancing, the wearing masks, the hand hygiene, and all that. And I think the restrictions that the governor did were very thoughtful, and I commend her for having the courage to do it, because I know she gets a lot of pushback for it. But it is. I think the restrictions are needed, and in support of that. And I can't tell people what to do, but it is. I know that we're not going to have Thanksgiving ourselves. I'd like to see my grandchildren, but we're not going to do it. I told my daughter not to come into town from New Jersey with my grandchildren. So it's sad times, but I think it's better to keep the small groups and distance, and I think the restrictions that the governor has put on are thoughtful, and they're needed, and we should do it. I mean, if it's up to me, I'd even go stricter than that, but it's not up to me.
Well, thank you so much.
You.
And these are really hard decisions that we have to make, and it's helpful to hear from you that these are very thoughtful restrictions that have been put into place. So thank you so much for your time, Jametta.
Thank you.
Yes, thank you. And just to underscore, not only are they thoughtful, they are based on science.
Right.
So our governor, and we had the benefit of wonderful universities and others, and awesome Michigan Department of Health and Human Services that also lean into science to inform us for what we need to do. So that underscores it. Families, I hope that you capture that information. We've heard from one of our top docs that as tough as it is, I'm a Nana. I can't wait to see my grands, but I will have to wait. This is the year of COVID, which demands something very different from us. But we've been talking a lot about our health, and we've also been recognizing that we have huge disparities in terms of how this disease has impacted not only African Americans, Hispanics, but also Native Americans and other marginalized communities and people with underlying and chronic conditions. But really, what does this new pause mean? I'm really pleased to welcome to the program Sarah Etsy. I have the pleasure of having met Sarah through Zoom, of course, being blessed to be part of Governor Whitmer's Coronavirus Racial Disparities Task Force, of which Sarah is a critical member of that, but she's also the Senior Deputy Director of Policy and Planning at the Michigan Department of Health and Human Services. Quite a mouthful, which means that there's a lot going on that you can share with us. Sarah, welcome.
Thank you for having me. So as Jametta mentioned, I have worn a number of different hats at the department, and most recently I am helping coordinate our emergency order, executive order process. So I think as many of you know, following the state Supreme Court's ruling in October that the governor did not have the emergency authority necessary to continue issuing executive orders, our department, Health and Human Services, came in to use our separate authority to control pandemics, which is a longstanding authority in the public health code for our director. And we have been able to reinstate many of the types of protections that were in place under the governor's executive orders through our DHHS epidemic orders. And the most recent of those is the 3-week pause that we issued on Sunday, effective yesterday. And so I thought I could just go through what is included in that pause and then give you time to ask questions and clarify anything that wasn't clear. So I hope you have all seen this infographic that we prepared that helps give a summary. At a high level, the things that are open are those things that do not involve gathering of people, particularly inside. And the things that are closed are things that do involve gathering or large crowds of people indoors. So people are still permitted to gather with one other household at their homes, although we have strongly recommended that people do so, only with one other family, not a different family over every night of the week. Where possible, people should be getting tested if they're going to be seeing new people they haven't recently. And we've actually put together several different documents about how to do safe gatherings as we go into Thanksgiving. So we're recommending that people not travel, not see new family members. If you pick one consistent family or friend who you will see over the next 3 weeks, that's much safer than seeing lots of different people. Still limit your time indoors. Still wear a mask and only remove it to eat or drink. Put it right back on afterwards. Don't share food or utensils. Physically distance inside a home. So if you can, for example, set up 2 different tables or sit on different ends of a table, avoid singing, shouting, cheering. Louder voices and louder speaking transmits COVID more. And that's especially true if people don't have masks on. We're also recommending people think about setting up a social pod, both for this time, but probably throughout the winter. And so this idea is that you would pick one other household that you would essentially join with. And that becomes your group that you regularly see, particularly if you want to see people indoors. And you would agree not to see other people outside the pod, except maybe outside with masks on. You would make sure that you understood who was still going to work or school or childcare in person. As that adds additional risk. And depending on the risk levels of the people in the pod, you might decide you really only want to be part of a group where everyone's being incredibly careful. People aren't working outside the home, aren't seeing others outside the home. If your pod is a lower risk group, you might decide it's still okay to, for example, see family members outdoors or to be working in person, and that you're all okay with everyone doing that. And so happy to take more questions on this. We realize it's a little bit of a tough or complicated topic, but it is a lot safer and lets people continue to have social interactions and see loved ones and friends, even while cases are going up and it's getting cold outside and harder to do outdoor gatherings. Going back to a broader just overview of the order. So things like retail, individual services like hair salons and barbershops, individual exercises, gyms and pools, outdoor dining, takeout and delivery at restaurants and bars. Those are all still open. Key like workplaces are open if you cannot work from home. So if you at all possibly can work from home, you need to be, but if you can't, manufacturing, construction, things like that can still be done in person. Childcare is still open so that working parents can work. Public transit also open so people can get to work, or healthcare or other essential services. Preschool through 8th grade remains open, subject to local choice. I think we know more now than we did early on that COVID is less transmissible, not non-transmissible, but less so for younger children, and also just the educational impacts of not being able to learn in person are much higher for younger kids who have a lot of struggles learning remotely. And so I think it is our view that we should do everything we can to keep schools for our youngest kids or kids with disabilities or English language learners, those who most need to be in the classroom, sacrifice elsewhere in our society so that we can keep COVID low enough that those folks can stay in the classroom as long as possible. And so that is one of the goals of this order. We also want to make sure, of course, that people can still get health care. We realize things like funerals are very hard to postpone. So although we have seen good amounts of outbreaks associated with weddings, funerals, church services, things like that, we realize that also people have First Amendment rights around religion, and that some exceptions need to be made. And we continue to encourage people to do outdoor recreation and be outside with, put a coat on and go out even as it gets cold. And then professional sports, including some bigger, like Big Ten sports that are doing 6-day-a-week testing of their athletes. Those sports can continue, but with no spectators. So that means that we've got, theaters, bowling, bingo, group fitness, kind of those big group settings where people come in to gather together. Those are closed. High schools need to be set up for remote learning, as well as colleges and universities should be remote at this time. Organized sports, any sort of like athletic competitions, except for those professional ones, are suspended. Bars and restaurants should not be doing indoor dining, and any work that can be done from home should be done from home. And so people should not be told they have to come into the workplace. So I am happy to take your questions and let me know how I can help.
Sarah, thank you. And so I was smiling when you said, in addition to your other roles, you now have this particular responsibility, and it's really critical. And so as we know, as the good doctor reminded us, that so much of us is about getting our community aware of these things and to embrace them, and that we use this knowledge then to empower ourselves to do the right thing for ourselves and for our children. Before we move on in continuation of looking at health and factors that are impacting our ability to weather through this COVID storm, do we have any questions that have come in about Governor Whitmer's latest action to keep us Michiganders safe? Christine?
Yes. So we have one question. Should we get tested after Thanksgiving if we meet with another family?
That's a good question. I think it depends. Certainly you should monitor yourself for symptoms. And if you are feeling ill, definitely get tested. If anyone else who you gathered with at Thanksgiving falls ill, everyone who is present should get tested and monitor themselves. It can take up to 14 days after an exposure for you to become ill with COVID. And you could test negative during that time, but still become ill later. And so in general, so you can't, for example, test out of quarantine if you've been exposed. And so in general, we do not recommend that people get tested after an exposure. They should just stay home in quarantine. And so I think we would say, if you are concerned for some reason, you might want to wait about 5 to 7 days after Thanksgiving and then get a test at that point. You still could become ill at any point during that 14-day period. But during the first 3 to 5 days after exposure, you almost certainly would test false negative. And so you would not want to go get a test on Friday. That would be a useless test. Unless you're feeling symptomatic. Obviously, if you're feeling symptomatic, always go get tested.
So I want to summarize really quickly so that people, if you choose to get tested, you would want to wait 5 days to ensure that the test is valid, and 3 to 5 days. Is that correct?
I think the most important thing is that the testing after Thanksgiving will not guarantee that you are not going to get sick, or are not an asymptomatic positive, because you could get tested on day 5, test negative. On day 6, you actually have a viral load that is now testable and infectious for others, and be asymptomatic positive from that point forward, or become symptomatic yourself later on. So I think it's very important people not have a false sense of security by getting a test within those 2 weeks after Thanksgiving and then thinking that they're fine. So I think that's the most important thing, is that like you need to, if you are gathering with other people, you need to monitor for symptoms. We recommend people check their temperatures, assess if you have a new cough, new shortness of breath, anything like that, for the 2 weeks after the gathering. Make sure everyone who is at the gathering is doing that. And if anyone starts to feel sick, that person goes and gets tested. Other people kind of try to self-quarantine until the person who felt ill gets their test results back. And then if that person is ill, then everyone who is at the gathering should get tested. If you would like to get tested, we recommend you wait a minimum of 5 days after the gathering for that test to be meaningful. But again, we generally don't recommend the testing as a way to kind of like know you're okay.
Thank you for that clarification. In the spring, when COVID first hit, there was economic supports put in place at both federal and state levels to make sure families were taken care of. Is the state going to increase unemployment amounts, implement rent and eviction freezes, and advocate for stimulus checks? And I'm sorry for the background noise, it's school.
No problem. I think the governor has been very clear that we think additional stimulus and support from DC is necessary. And we would strongly urge the federal government to provide relief for small businesses, for people who are unemployed, for others who've been hit by this pandemic. Beyond that, I think that would really be a question for the legislature as to whether they are considering additional economic stimulus at the state level.
And then
Sarah, I'm sorry, Christine,
Yes.
we're getting notices from the background.
Got it.
We have an awesome production team that is texting and letting us know that we are really actually needing to move forward, because we have some other really critical voices. And these are all questions that our communities want and we want as well. Sarah, thank you for doing those. And Christine, if we have any further questions, could you pop those into the chat? And then Sarah and others, we would love to be able to send those to you to get feedback on later.
Well, it looks like we're good for right now, but we'll make sure we get those to you. Sarah, thank you so much.
Thanks for having me.
Thank you. So you want to continue our discussion relevant to health. Again, keeping us empowered and keeping us informed. And we've talked a great deal about underlying conditions that can exacerbate or make our experience with COVID so much more dangerous. But we're really pleased to be able to have us talk about this reality is Dr. Edith Kiefer. Dr. Kiefer is a professor emeritus of social work at the University of Michigan. And she's going to be joined by her colleague, Stephanie Perez, also from CHAZ, who works with us all the time. So Dr. Kiefer, welcome.
Okay, can you hear me? I am trying to figure out.
Yes, we can hear you fine.
And can you see the screen that's
You're all good.
Okay, because I have Zoom in front of me. Okay, so thank you for the opportunity. As Dr. Zervo said, there are disproportions between communities in terms of COVID's risk and severity. Frontline, let me see, whoops, I'm having trouble advancing the slide. Gee.
There you are.
Okay, so frontline work, crowded living and working conditions, and lack of access to adequate health care as well as sometimes necessary supplies to keep oneself safe, and reliable and not conflicting information have all gotten in the way and affected many communities of color. I'm going to be talking a little bit more about diabetes because health conditions like diabetes, heart disease, asthma, and other chronic health conditions in particular make people more susceptible to COVID, and especially to severe disease as a result of being infected with COVID. A little bit more, I'm talking today about diabetes and particularly type 2. There's some evidence that type 1 diabetes, especially for any of these, if it's uncontrolled, if blood sugar is out of control, or potentially gestational diabetes, all could be increase the risk of developing severe COVID. I want to mention heart disease as well, because in many cases, people with diabetes also have heart disease, and people with heart disease often also have greater risk of complications due to COVID-19. At the end of my presentation, there will be some resource slides for people with type 2 diabetes, as well as people with heart disease, and some general resources, and hopefully those can be made available to folks participating today. I want to say a little bit about community health workers. So we've been talking about the disease itself, the problems with the disease. I will say, I guess going back for a second, why diabetes? Well, one of the big things that happens with both diseases, both COVID and diabetes, is inflammation. And people who've had diabetes, especially for some time, often have have elevated inflammation in all their body systems, and they often have very fragile blood vessels. And as many of you probably know, one of the complications of COVID that leads to severe disease and sometimes death is really big problems with blood vessels, clotting, strokes, things that happen as a result of inflammation and fragile blood vessels. So that's one of the things. Another thing with diabetes is that many people with diabetes have lower immunity. So they are more likely to get any number of diseases, and this is one of the most severe. So what do we do about it? I guess I did want to address that. I'm a proponent of community health workers. These are frontline health workers whose community membership, life experiences, and understanding of neighborhoods, language, and culture help build trusting relationships with the people in the communities they serve. One of the things community health workers do is to increase health knowledge of community members through outreach, education, informal counseling, social support, and advocacy. They often improve the quality of care, and very importantly, in terms of COVID and diabetes, they increase the knowledge of other healthcare providers about the needs of the people they serve. And again, the previous discussions had to do with things like the disease itself and getting that, preventing it. Also, it's going to be coming in terms of vaccine. It's super important that the people who convey messages to community members are well trusted by those community members. And so it's logical that community health workers may play a major role in that. They also contribute to addressing the social determinants of health that were explained earlier as contributing to risk for diabetes, both diabetes and its complications and COVID and its complications. In Detroit, there's a long history of community health workers working to improve the health of people and the communities they serve right here. For the last 20 years, there have been a number of programs that specifically have had great success in helping Detroit community residents improve their diabetes self-management, get their blood sugar control, and have other improvements in their longer-term health outcomes. And they're now improving the health of people with diabetes and in relation to the risks in terms of COVID-19. I know I'm going really fast, but I want to leave time for Stephanie Perez, who's co-presenting with me, to talk a little bit about a program at CHAS Center in Southwest Detroit that specifically is addressing the needs of people with diabetes, but also helping them in this time of COVID-19. And then I'll welcome questions later. So if you could bring in Stephanie. And this is the slide we'll be working with.
Here. Okay, so hello everyone again, and thank you for joining us once more. So yes, FAM Act is an NHA funded program at CHAS Center, and it's actually testing a CHW program that's designed to help patients and their support person better manage type 2 diabetes. So community health workers are one of the key points there. They are providing education classes currently. They talk about diabetes awareness, diabetes and how it's related to COVID, healthy eating, the visits with the provider, exercise, medication, diabetes complications, and other types of care, which includes their foot care, oral care, and eye exam, and how all of that is important. In addition to that, they are setting goals, which helps them, keep on track, knowing that someone's there to help them out. These goals can be, for example, eating more vegetables, making sure that they get, those 3 hours of exercise per week. In terms of the COVID-related support, the CHWs are there for the patients. Their main support is to help them, connect what they may need from the patients to the provider, and they basically are the bridge for the patients to have that key communication. So the CHWs are discussing with the patients any concerns that they may have in terms of COVID, where they can get tested for COVID, as well as where food distributions may take place. We do have food distributions at CHAS, but also any other place within the community. In terms of the challenges related to COVID right now, CHWs are unable to provide services in person due to the social distancing and not having, more than 15 minutes in the same room and all of that that's going on right now. So instead of that, rather we have strategized a way to be able to offer the classes via phone, so as a conference call, or via Zoom. Some people in the program are still experiencing some challenges in terms of connectivity, whether they have the resources such as like smartphone or tech issues, but we are trying to work around that to better help them with whatever they may need. In terms of the response, the overall response of the program is more awareness. Patients are more aware of how they can better manage their diabetes. The support person is also more aware of the do's and don'ts in helping the patient manage their diabetes. In addition to that, in terms of the education that they are receiving in the classes, both the patient and the support person have expressed a sense of empowerment. It's not just the education that they're receiving in the classes, but it's also the experience that they're sharing with one another. So they get to learn from each other with everything that they have going on, knowing that they're not the only ones who are working to, better manage their type 2 diabetes.
Thank you, Stephanie,
Thank
very
you.
much. I'm going to show the 3 resource slides. I'm not sure where we are in our time, but these are the slides. 2 of them are from CDC that you've heard about in the news. And so these are actions to take if you have diabetes. And a lot of these are things that Stephanie just addressed in terms of the important things that you need. Having control of your blood sugar is super important in terms of reducing the likelihood of severe disease, both from diabetes itself, as well as from COVID. So these
Dr.
are a
Keeler?
list. Yes?
Yes, so if you have the 3 slides, we would love it if we could have copies of that.
Yes.
We'll make that available in our chat. And
Yeah,
also,
and we can do questions.
I'm sorry, if there's also a contact number for yourself, and Stephanie, the wonderful program, also a proponent and of community health workers, not only for diabetes, but for so many other conditions that affect our health and wellness.
Yes.
Is your information also available on those slides?
I didn't put it on the slide, but I can make it available.
Okay.
Stephanie,
All right.
the cover slide has Chas's email.
Okay.
Or,
okay.
Yeah, it's website.
Okay, I want to thank you so much. We are going to need to move forward to our next segment.
Oh,
This is always one of the hardest parts of asking people, knowing you have so much more to share, to say that we do need to move on. Please let us get copies of those, and we hope the audience has heard really clearly how controlling and staying on top of your diabetes is so critical at all times, let alone during this time period with COVID. So we really have been focusing in on health, but as you always know, the schools have closed. And this has huge impact on our families and our economy and on our lives. And to help us understand what those decisions are and what alternatives might be available to children who are part of the Detroit Public School Community District, we are delighted always to welcome back Crystal Wilson. Crystal is the Deputy Superintendent for Communications and all things that have to do about helping our families understand how to access the education available in the district. Crystal, please join us.
Hi, Jametta. I'm not
Hi,
sure
how
if
are
you can see me. Hi, everybody. Jametta, you gave me a title race. I'm the Assistant Superintendent of Comms and Marketing for
You're the queen of
DPSCD.
communication. How's that?
So let me get at it then.
Okay.
Last Thursday, Dr. Vitti made the announcement that all face-to-face classes would be temporarily suspended due to the infection rate in Detroit breaching the 5% mark. In our guidance from the AFT, we knew that when the infection rate reached 5 to 7%, that we would consider shifting all of our classes to online. So with that, on the next slide, we have a lot of support available for our families so that they can continue to acclimate to online. And we continue to have homework hotline support, mental health support, and also IT support. And I'd like to talk a little bit more about the IT support. Next slide. The percentage of technical issues reported for our Connected Futures devices is typical for a deployment of this size, and that doesn't make it better. But we wanted to put it in perspective around how many requests we've received. The requests are declining from October to November, but we do probably anticipate an uptick from November to December due to us shifting online. Many of the issues that we are preparing to solve for is that the device won't power on, microphone trouble, a cracked screen, broken keyboards, and connectivity issues. So what are we going to do about it? Next slide. We know that the impact for student learning from home is not typical. We know it's hard. And we know that when a technology issue arises in the classroom, teachers can usually work hands-on with the student. However, when it's happening at home, they have to wait for a technician, and this means losing class time. So what we're doing is we're going to solve for that through 13 technology and family resource hubs. Next slide. So we've identified the challenges, and we are now going to work through the community hubs to help support our online learning. Next slide. More about the hubs. The technology and family support hubs will be easily accessible. They'll be located throughout the community. You'll have face-to-face support, of course, practicing safe distancing and wearing of mask. And also you'll have same-day problem resolution in the majority of the cases. We'll provide families with technology help, online learning support, and community resources. Next slide. Some of those technology support resources, we will work on technical support, warranty and repairs for your devices. We'll provide loaner devices and also digital literacy training. We know a lot of our families who were on face-to-face and who moved over to online, they're starting fresh, so they don't have a lot of their questions answered. So we're going to commit to providing resources for you and your families. We are going to have help, provide help with the online learning platforms, MS Teams, and Schoology, and some of the other platforms that we use. And also we're going to have parent-teacher admin communication support. We've heard that a lot of our parents can't reach their teachers, so we're going to provide additional support in that area. And then we're going to provide community resources at the hubs. So utility assistance, food banks. We're also going to introduce mobile COVID screening in partnership with Wayne State University, and also connections to childcare options. And we ask that you continue to visit DetroitK12.org for updates as we continue to get feedback and add more offerings to the hubs. Next slide. This is where the hubs are going to be located. We're strategically placing them across the city so that we're coming to you and your community. So they're going to be placed on the northwest side, the west side, the east side, and the southwest side. And so right now, these are the 13 locations, and we'll continue to review these locations to make sure that they work for our families. And they will be open starting December 1st, 2020. Next slide. Oh, I think that's it. But again, visit DetroitK12.org for Parent Academy classes. And I just want everybody to know on Monday, Southeastern is having a turkey drive, and you'll be able to get a free turkey. So go to Southeastern starting at 9 o'clock while supplies last. Again, thank you to the coalition for allowing us to share up-to-date information about Detroit Public Schools Community District.
And thank you, Crystal. And as we said earlier in the program, we're really so appreciative of the thoughtful analysis that you've been going through. You've listened to your families, you know the concerns and the challenges they've had, and you're trying to create a plan to implement it. So know that all of us will continue, as we do with all of our school partners, to say families connect, let's love on each other during this time period, because it's extraordinarily and very challenging. And thank you also for making sure that there are food supplies, and we're looking forward to seeing you at the COVID testing sites. That would be wonderful. So we're going to continue. And we want to know also what's going on. We recognize this is about 35% of our children in the city attend charter schools. So it's always important that we are providing a platform for the voices of charters to be heard as well. And so we're pleased always to have Rajeshri Bhatia to join us. She is a Detroit lead for the Grand Valley State University Charter Authorizer's Office. Quite a bit for someone who is quite a person and has a real passion for children, just like Crystal and others. Rajeshri, welcome back.
Thank you. It's nice to be here, and great to hear all the wonderful information. I think I echo much of what Crystal said in terms of what's happening with our schools. So obviously the governor's mandate impacts all high schools, including charter high schools. So they have all gone remote if they were not already. As far as our K-8 schools go, many of them were offering in person and have made the shift to virtual. And additionally, many of them are looking to go virtual through January. We all are seeing the same numbers. We're all seeing the same impact. We're having the same, sort of ramifications in the schools. So listening to our parents, paying attention to health data, and also deciding what's best for our students on a monthly basis with our board meetings. That's kind of what we see schools doing. We have seen in some cases schools that were offering in person have had to sort of shift because they've had exposures within the school. And again, that's unfortunate that it's happened, but it also is a sign that the processes that have been set into place are working. And so, we're all following the same set of rules as mandated by the governor's order and following the lead of the county health departments. I think similar to what, Jametta said, I think that the biggest thing that parents can do is continue to stay engaged with their schools. Most of the schools are having town hall meetings, conferences. There are opportunities for parents to voice their feedback and concerns, and we're listening. I myself have been present when parents have attended board meetings and have shared their concerns, and we take it very seriously. Each charter school has its own board, so it's kind of an entity unto itself. So parents do have an opportunity to go and share their feedback with the school leadership and with those making the decisions. I will point out that even though some schools may have put out there we're going to be remote for a longer period of time, based on the state law and what we're under, all schools boards do have to meet every month to recertify that plan. So as an example, if a school says we're going to be remote through February, that may be the plan, but the board still needs to meet in December and January and February to recertify that, just to ensure that the data is supporting that decision. If something magically happens and COVID disappears in January, well, then there would be no need to stay closed till February, right? To be remote. So sometimes that causes confusion, but I want to just reiterate that every board is meeting every month and looking at county health data, the interaction data between the students, as well as parent feedback and teacher feedback to ensure that they're making a sound decision. But we also recognize this is tough. This is tough for everybody. And so charters are also participating in some of the citywide efforts spearheaded by many of the individuals actually on this call to help find solutions for parents in terms of childcare, in terms of support, from an academic and honestly a mental health perspective. As we just heard, that's super important. I myself have a 5-year-old and a newborn at home. And so I know firsthand how challenging it is to do it all and to keep our wits about us while also trying to work and be people ourselves. And so that's really important to all of us in education recognize that parents are contributing in ways that they have never been asked to do before, and we appreciate it. And so we want to make sure that we are supporting our parents and our students in through all of our efforts.
Rajeshri, thank you. And you underscore the reality that as a parent yourself, and I think sometimes we forget that. COVID has really created a lot of flattening of titles and what people thought were their privileges. I mean, they still exist, but you really know what that's like. And we also want to let families know that your teachers, your administrators are struggling just like you. And that's our opportunity to come together to really be powerfully supporting each other and loving on our children and making sure that that they don't have a COVID slide and we're moving them forward. So we've also need to be talking about how do we move forward to assure that our vote. Detroit showed up, shined, and showed out. And that happened all over this nation, particularly in communities of color. And but we know when the people step forward to say our voices will be heard, there are those that historically have said, no, your voice does not count. But we know we do not go along with that, and we stand in unity against it. And to help us always in this, we've got to have the legal community to do it. And one of the foremost and leading attorneys that's been specializing not only in progressive politics, but helping us stay on top of what's going on with our voting rights is none other than Mark Brewer. And Mark will also be joined with Ray Lanier, who will be talking about what they are seeing at the Michigan liberation discussions and updates about the election. So let me open that up and welcome the two of you to the program.
Thank you very much, Jametta. It's great to be with everybody, and thank you very much for the invitation. So what I'd like to do, and I want to, Ray and I are going to do this together, is basically quickly give people an overview of where we are in the post-election process, so they can understand, where we are, and then after Ray talks, we can, answer questions, time permitting. So I'm just going to plunge ahead here because I know time is tight. So as you all know, we had the election on November 3rd, and great job, tremendous turnout. It was really a great day for Michigan. Those results on election day are unofficial. Those are not the official election results. And we have a time-tested process here in Michigan. It's been used for decades. It's bipartisan, it's transparent, under which each county in the 2 weeks following the election reviews those unofficial election results. They review the paperwork to make sure that there are no math errors, that all the votes were counted, that the paperwork was properly completed. That's done by what are called county canvassing boards, boards of canvassers. They have 2 weeks to do that. And I'm pleased to report that all of those boards met that deadline of Tuesday, November 17th. So that process is completed. All of the counties did their jobs in a bipartisan, transparent fashion. The next step is for the state board of canvassers, which is a 4-member bipartisan body, to meet and certify those results on a statewide basis, having seen all the county reports. That meeting is scheduled to occur next Monday, November 23rd at approximately 1 o'clock. It's a public meeting, as all of these board meetings are. And as we expect, as has always happened, that board will unanimously certify the statewide election results next Monday. And then the election results will be official, and people on the ballot throughout Michigan will be deemed elected at that point. That is the end of the process. 2 quick points, and then I want to turn this over to Ray. People can ask for a recount at that point. They have 48 hours after the board acts to ask for a recount. And that's an important right, and people have a right to exercise it. And then finally, in terms of the presidential process, because I'm sure you're all curious about that, the electors, the 16 electors who represent the winning presidential candidate, officially meet on Monday, December 14th at the state capitol to cast their votes for president. Their names and their votes will have already been sent to the Congress and to Washington, but the official day for that to occur is December 14th. That has been a wonderful ceremonial day when we celebrate democracy with this last official step in the presidential election. So that's all for me in terms of an overview, and I want to turn it over to Ray.
Thanks, Mark, and thanks everyone for having me here. My name's Ray Lanier. I go by she and her pronouns, and I'm the Wayne County Director for Michigan Liberation and a proud member of the Metro Detroit Action Council. So everything that Mark has laid out for folks is absolutely true. I want to talk about things more from the organizing side of things and rewind it back to the Wayne County Board of Canvasser meeting. So folks may have seen that there was a deadlock 2-2 vote stalling Wayne County certification, and the people were well organized, and we were able to have an outside-inside strategy. It looked like having a presser and car caravan directly outside of the Vigliotti building where they were certifying votes to make sure that we're making a formal request that you need to do your job and certify them. And then on the inside, we packed as many people as we could into that Zoom room, increasing the capacity twice, to be able to make sure that we got as many folks as possible. It still wasn't enough room. There were many folks that were stuck in the waiting room if they were lucky to make it that far. And so we also had folks that were also on the live streams and posting comments and signing up for public comments the entire time. That strategy was extremely successful. It didn't look like it from the outset because they actually took the vote before we were allowed to have public comment. But the public comment was so searing that they made a second unprecedented move that night by going back and changing that vote. Things have progressed. I think we just got word yesterday or today that those 2 Republicans actually wanted to rescind their votes. We know, and Mark can correct me if I'm wrong, that like the deadline has passed. Right now, we're kind of in the realm of political theater and narrative. But as organizers, as voters, as concerned citizens, we need to make sure that we always have a counterbalance to that narrative, right? And so what that's going to look like is between today and on Monday, the 23rd, we have several different ways that folks can plug in. The low barrier of entry that I just want to say to everyone is we do still have our pledge that we're going to remain patient, that we're going to respect the integrity of this process, and that if the time comes that we're ready to mobilize with our voices to make sure that our representatives do their job. The second way to plug in is today, there is a House Oversight Committee hearing where we're going to have presentations from, I think it's Antrim, Kent, Ingham, and Ingham counties, where we suspect that there's going to be a narrative push to uplift this false story of voter fraud, particularly uplifting the problems with the voting system. In this case, it was Dominion. We know that regardless, even without the state of Michigan, that Joe Biden has won. This does not stop the right, though, from creating a toxic narrative that will continue to disrupt this process, but also in future municipal and larger elections. So for folks who are interested in getting down with things that are happening today, we want folks to live tweet at the House Oversight Committee on Twitter. We will be making sure that folks have a live stream feed so that they can get in. It's my understanding that this meeting will take place on House TV, and so we want as many folks to look at that as possible. We did have plans for folks to actually email and ask to testify. However, they have blocked that very politely. And so we have the side strategy of hashtag if I can testify. And what that looks like is people making videos very similar to the ones that we saw during the Wayne County Board of Canvassers meeting, where folks can really, let these folks know how they feel about blatant attempts to undermine democracy, how it, just because you don't like the results, that it does not excuse you from avoiding your job, and what this election and the certifying of its results means to you. So that's one way that you can get involved for today. I want to talk briefly about Monday, because this is where we want to drive a lot of traffic to. As Mark has said, this is the State Board of Canvassers meeting. Now that all 83 counties have certified their results, this is where we put the cherry on the top with the state. And like Mark said, it is still a 2-2 makeup. The state, Jocelyn Benson, along with the 2 Democrats, have vocalized that they are prepared to move the process forward. But the 2 Republicans, like in Wayne County, have remained otherwise silent or non-committal. We want to make sure we're bringing that exact same heat. And so we're going to scale up what we did in Wayne County. We'll be meeting in Lansing before the 1 o'clock meeting to stage a car caravan where we can make sure we have that counter narrative out, that we're making sure that people know that the voters of Michigan decided. We decided that Black Lives Matter. We decided that healthcare is for all. We decided that no human being is illegal. And then we're also going to pack as many people as we can into that Zoom room, signing up for public comment, making sure that people are live tweeting on Twitter, both at the House, both at state legislatures, as well as the members of this State Board of Canvassers. And yeah, if you have any interest in that, I'll go ahead and drop my email in the chat. You can also reach out to Molly, and I will cede the rest of my time.
And I'll just chime in. Ray is absolutely accurate. Agree with everything she said. Love her. She's great, doing a great job. Keep up the good work.
Yeah, and it's so appropriate to talk about an office of liberation because that's the perspective that we need to have in this work. Our vote is about our ongoing struggle for liberation. And with that, Christine, do we have any questions?
Yes, I think we have one really very important question. Could one or both of you clarify what was the identified problem with Detroit and the Wayne County votes, and how many of those votes were in question? What do we need to do, or what does the city clerk need to do, or others, to resolve so that there's no question that are these votes, that the process was done properly?
Ray, can I take a crack at that? Is that okay?
Yeah, absolutely.
All right. So let me start though. I want to make sure that people understand that what the 2 Republican board members in Wayne have now done, they wrote these affidavits and they said they've rescinded their vote. Those affidavits have no effect whatsoever. That meeting is over. As you all know, boards only act in meetings through motions. And furthermore, after Tuesday, that board has no jurisdiction anymore.
Oh.
So that is pure political theater, what is going on with those affidavits. They have no legal effect. In answer to the question, the issue that the Republicans inappropriately leaned on Tuesday was this question of what are called unbalanced precincts. Michigan is unique in the entire country by saying that the paperwork record of how many voters voted has to match exactly the number of ballots. That doesn't mean that votes weren't counted. Every vote gets counted. The only effect it has is that if somebody asks for a recount, that precinct can't be recounted. That's the only effect it has. Unbalanced precincts occur throughout the state, so it's unfair, racist, frankly, to focus on Detroit in that regard. They happen everywhere. A board has no authority to refuse to certify based on that. Boards throughout the state for decades have certified, notwithstanding those precincts. Indeed, this board last summer after the August primary certified the election unanimously, despite the fact that there were some unbalanced precincts. So that is not a justification. I'll just wrap up with this. I don't know the exact number, but these discrepancies, these unbalanced precincts, the paperwork's usually off by a vote or two. You know, it's because some voter didn't want to wait in line and she left without voting. Or a machine got jammed and a ballot may have run twice. Or a ballot got damaged and had to be duplicated. So it's always some human, innocent explanation. I've been practicing election law in this state for almost 40 years. I have never seen voter fraud that shows and creates unbalanced precincts. It's human error. It's a big system, millions of people participating. So in Detroit and even elsewhere in the state, I would estimate that the number of votes at issue may be in the hundreds in terms of the balance. It's, you know, 1 or 2 votes in several precincts. It's not enough to change the result in any race whatsoever. So sorry for the long-winded answer, but that is a lot of disinformation that we need to make sure people understand that it is misinformation and it's not a basis to set aside the will of the voters.
Yeah, and if I could just add, so like Mark said, you know, the variance that they were talking about is normal within our state. They actually had to certify the results of the August primary, which if you were out there doing GOTV, you know it was a hot mess. And this was the most secure election in American history. You want to talk about problems with variance? Let's talk about Livonia, which had a much higher level of variance. And actually, we were lucky enough in that meeting to have the city clerk for Livonia on that call. And she was disgusted that they would go so low to not certify the results. I believe Monica Palmer had said, like, I know there's no statute, but it does not change my vote. So this is why it's very important to have that counter narrative, because this process, even the building, it's so benign. None of us, I can't speak for it, but I have never thought about election certification, who does it, where it takes place. If we had not been watching closely as a community and organizers and movement builders, that deadlock vote would have happened and it just would have snowballed. This is why we want to make sure that we're having intentional time to explain to everyone what's going on and the importance of why we need people to mobilize in whatever form, whether that's in person or remotely, to make sure that, yeah, like it's up to us to maintain the integrity of this process. And I just want to quote Mark, because we had a call the other day. You said that there's many veto points in this process that regular civilians don't have to know about. It is our duty to make sure that we are right every single time for those veto points, those chokehold points. It's only going to take our opposition getting it right one time. So we can't sleep yet, maybe in 2021, but we are in it for a long, sustained battle, and we're already kicking, but we just need to make sure we have enough energy to keep it going.
Thank you both so much. This has been like the greatest civics lesson ever. Better than any government class could provide. And thank you for reminding us all how vigilant we really need to be, and that it's important for us to be a part of the process. These are our votes. This is, we vote in who should represent us. And so, and we need to be vigilant in every part of the process. So I will kick it back to Jametta. Thank you both.
Good. Thank you so much. I got to say this, as I listened to and I've seen what's going on, my dad used to always call Michigan, Mississippi. Because the reality is what we've been witnessing is really what we saw in the 50s and 60s in the South. And we have to be even just as diligent. And those of us who don't know history, we are doomed to repeat it. Thank you, Mark. Thank you, Ray, for being the warriors that you are, knowing that inside game. To everybody else that's out there, we have to be at the forefront of making sure that we are walking in integrity and demanding other people do, no matter how crazy they may act. We know who we are. But part of being knowing who we are also is we're moving into the holiday period, and we're moving up on a celebration that this country has been engaged in for decades, and if not for hundreds of years, has had a mythology, if you will, around Thanksgiving. And just like we try to do in everything, is that we want to unbundle the truth and have us be more mindful of particularly the struggles of Indigenous people and others who have been maligned throughout history. And so we're very happy to invite Andrea White, who is going to share some important insights about the origins of Thanksgiving that hopefully will encourage us to be more thoughtful and to perhaps rethink how we are thankful. Andrea, please, welcome.
Andrea, you're muted.
And don't feel bad. We all go through this. Okay.
Very good.
On.
Very good. You're on.
I'm on. Okay. Thank you. Thank you for inviting me. Yeah. Thanksgiving is like an odd kind of idea, I think. I'm going to talk about my perspective on the whole situation. First off, I'm Ojibwe from Sault Ste. Marie, the original band of Sault Ste. Marie Chippewas. But I live down below, as they say, up north. And I have spent a lot of time in the community working with not only Indigenous natives from the north, but with the Latino people in the southwest side of Detroit. And so I've had some time to blend my perspective with what I know of my culture to kind of plug it in with how we live today, which is what we've all had to do as people of color. You know, we've had to figure out how to make the best of it, I guess. A lot of us, well, my people in particular were asked and forced to give up the language. So how we understand the world is through the English language, which is odd, I think. And it's a sad thing that not very many of us are speaking our language. I know some phrases and I know some words. I know what things mean. And then it translates not very well into the English language. But one of those things is like the whole idea of Thanksgiving is a sharing, right? It's a sharing of what you have and who you are with others. And those others, I guess the original ones, the original whole concept, I don't know where that came from. And I don't know what group of people brought that to into being. But it's like it was a one-time thing, or it was a once-a-year thing. But we have, and you know, from what Native people do, is there's a Thanksgiving for almost it's a regularly practiced idea. We have that for each grouping. When we have meetings that are native focused or native based, or if we're included, we make sure that that's part of it, to give thanks, to share what you have, and make sure that all that you have is shared with all those that are around you. I guess that's basically my perspective. You know, the whole concept of sharing is a responsibility. We would take what we have and just make sure that make sure that we included you. That was a responsibility. That's the Anishinaabe way. And we do that whenever we can, and each and every time that we can, because that's the way that life goes on, and continues to be balanced and happy. There's a share, you know, the whole idea of the first Thanksgiving was a sharing, and we've seen all kinds of things in the schools and of course, in commercials and all kinds of media these days. And one of the things that I saw were the foods, you know, the turkey and all that. And I think that the original Thanksgiving was probably Native people who shared with the European people. First of all, they wouldn't have had the wherewithal to set up their gardens, and they didn't know the land. So there would have been, you know, this would have been part of our helping them, bringing food. We understood that when they got here that they were in tough shape, and they were starving, and they were dirty, and they were sick. So what do? We go and help them. And there may have been good feelings. I would like to think that there was good feelings with both groups. And so there were foods that were brought in, and, you know, there would have been, if it was late in the year, there would have been foods that were already prepared, put up for preserving through the winter. Then there would have been a fish and a hunt. So then they would have brought fish and some game. There would have been plants that were used by us during the year, and so that would have been, it would have made more sense to me, I think, that those foods that were put in place to put a meal together would have been done by us and shared with them. And I like to think that's, you know, the right way. So the whole idea of the food thing, you know, was kind of, I've seen some different articles on that were, you know, we didn't have pumpkin pie, and we didn't have cranberries. Not like that anyway. Anyway, but the whole idea of sharing the motive was that was a response, that was our responsibility. The sharing, what we did learn though was the sharing sometimes was a deception designed to either further the end, further the cause, I guess, or just, to possibly take advantage of later. It's okay though, we shared and we still do that. We still share. We still think of fulfilling that responsibility because that's what we do as people. And I think that's pretty much what I put down for what I, part of my perspective on Thanksgiving. I look forward to that. It's a time of season change, so that we're going to start into like the winter. This is kind of like the send off of all the foods that we still have that we're growing. Their harvest foods, and so they're still typically, traditionally, there are a lot of fresh things to partake of and share in. And then you get into,
Andrea,
yes.
yeah, thank you so much. And I think if I could just lift up something that you just shared, you just talked about the inherent nature is to be thankful and to recognize that what the seasons bring us the opportunity. And while we may know that there are others who've taken that spirit, that graciousness, whether it was with the Anishinaabe or other indigenous tribes, and used it for something else, the beauty of that is still intrinsic to you as a people, as individuals, as in people, and that's a gift to all of us. So I want to thank you so much, and I want to please invite you that if in fact there are other resources that you might be able to provide with our families, to know different, not only how different indigenous groups have celebrated it, but also what is the realities of Native peoples, because too often we perceive people through what we've seen on TV. And we want to get past that, and that's what our whole process is about here. And so please pardon me for stopping you and asking you if you would kindly then share some resources, and we want to thank you for blessing us with your perspective.
Thank you.
Thank you. And so Christine, speaking of thankfulness, I see a little bambino on your lap, or kind of in the background there. Everyone knows that we are all about family and children. So children are welcome to move in and out of the screen because they are part of who we are. And so we're wrapping up now a really awesome segment. And Christine, I'm going to hand it to you because in the spirit of thankfulness and being righteous and focused on liberation, you've got some more resources to share with us. Thank you so much, and I'm passing it on to you. Thank you.
Thank you, Jametta.
Part of the program.
Yeah, and thank you for reminding us how important it is, the thankfulness and the giving, and giving of ourselves and giving to each other, and that we belong to each other. I think that was something really powerful that you just said, even when people perpetrate great harm. We need to close out because we are incredibly over time. So I am not going to remind you guys of numbers and things of that nature. We can go over that next week, but we do want to say we have some wonderful folks that are part of our team that put together resources for our audience and for those of you that are watching. Those resources we are going to put into the chat right now. And next week we hope to have, since we know we're going into this pause order, we're in this pause order, and we all are I'll explain to you after I'm done. We we all are, a little fatigued with where we're at right now. So we hope to bring you some games and some joy that you can engage in with your small pod family. And so we'll have that for you next week. So the resources are going into the chat. I'm going to just ask everyone to stay vigilant during this time as we're getting through the election season and through the process so that we can have a certified election. And I think uplifting what Andrea said about sharing and thankfulness and giving. And if we can all walk away with that as we remember that we do belong to each other. And so this pause order is symbolic of that. And we hope that everyone has a wonderful, wonderful Thanksgiving. This town hall is truly a group effort. So before we go, can everybody turn on their videos? And we want to remind everybody to stay healthy, stay strong, and stay powerful. You want to say goodbye? Say bye.
Bye.
Happy Thanksgiving.
Everyone, stay strong, stay blessed, stay masked up.
Christina, can you say it in Spanish, please?
Sí, manténgase saludable, manténgase empoderado y manténgase fuerte. Gracias.
Thank you. Everybody have
Take
a
care.
great,
See you the
great
first week
holiday.
of December.